They say that one of the things that people ignore the most medically is eye care. Here at Dr. Leeks on Calvada, there's no need to do that. They do take all types of insurances. We're going to speak to Dr. Leeks.
The three O's of eye care, we usually refer to them as the ophthalmologists, the optometrists, and the opticians. And all of them play a vital role in eye care. The optometrist is usually the entry point into the eye care health system. And the optician will help fill the optometrist's prescription in terms of eyeglasses and contact lenses. The ophthalmologist will treat the eye with when you need surgery or any kind of advanced treatment like that.
We're here in your office on Calvada, right in the Calvada eye. People come to see you. How frequently should a person get their eyes checked?
We recommend eye exams every year. Once a year, everybody should get an eye exam, and more frequently if there's a problem that needs to be treated, or if we put a person in treatment.
Starting at what age?
Starting at age, I like to start the children off at about 2 years old, and if there are no problems, then we can extend that for a couple of years until first grade, and then 1 year after that, every year after that.
Let's talk about some advances in your practice. Some of the things that maybe if you haven't been to a doctor in years, I know they're always coming up with new stuff.
The biggest advances I've noticed in my practice have been the technology. We have instruments now that can read your prescription right from the start. You can just look into it and it'll tell us what you need to see better. We have instruments that allow us to see underneath the surface of the retina to see if you have problems that are not visible from just looking straight at the surface. We have instruments that can automatically compute your visual field, how far you see in left and right, and all those kinds of things. And also in the contact lenses, we have contact lenses now that a person can wear up to 30 days without taking them out, and everything in between.
There you go.
Yeah.
And the frames are now lighter, all different styles that you can possibly imagine for every type of taste.
That's right. We have the AutoFlex type frames, the ones that are pretty much indestructible. You can bend them and twist them and they always come back to their shape. We also have the frames that are made out of carbon fiber, and they're very, very light. Sometimes you can't tell you even have them on, and that includes when you have the lenses in them, so they're very lightweight, and that's especially important to people who have a high prescription. But for the most part, we have materials that we can make many, many wonderful designs or fashions for the frames.
And the phone number here?
Our phone number is 775-727-8300.
And if you have a question for Dr. Leeks, of course, we'll present it to him. We'll be talking to him again in 2 weeks. So if you have a question, you can send it to Deanna at KPVM.tv. This is Deanna O'Donnell for News 46.